Now let's talk about all these fancy prognostic markers just briefly. See, I told you I'd do CLL 101. So clearly these are the prognostic markers that many have talked about and the ones we've focused on because these are the ones we know about, okay? And so it's, for those of you who get very sophisticated, you make a chart, you get online, and you go, okay, let's go bad, good, intermediate, and you list all these and you go, okay, what do I have, what do I have? Now many of our original studies on all these prognostic markers were retrospective. So we would look at these markers and go, well, if you had this, you did this. If you had this, you did this. And then now you put them all together. So the problem is that not everybody behaves the same. So we can talk about our folks with 17p because traditionally, if you look at that classic Donner paper that Dr. Keating and others showed yesterday, that traditionally folks with 17p have a more aggressive disease course, that their time to their first treatment is sooner than everybody else. That's true. But are there people in our practice that have a 17p that we've monitored for years, never treated? Absolutely. So their biology is different. Clearly, do we know everything? Obviously we don't. So I think it's important, for those of you who follow this, it's important to know your prognostic markers. We wouldn't, believe me, it tells us something too as we're learning more about treatments and also how to better our treatments. But remember, what's really, really important is the tempo of your disease, because everybody could be different. And so I hold that out because there are individuals who have, 13q that, I've treated, within 2 years, which is atypical. And then I have a gentleman who may have 17p that I haven't treated in 7 years. So clearly there's not, we are learning about the biology of CLL, and you can have a mix of good and bad features all at once, and we're still trying to put this all together. So it's, in truth, what we were saying with all that fancy data yesterday about where people fall out on the curves, and we're trying to break that data down, particularly with new treatments, and so that's all very important, but each of you are individuals, and so you need to understand and respect, as we respect, that your disease could be different.